Welcome back, dear doctors, in Anatomy Student Zone. Today I will cover lumbosacral plexus. Hope you will have studied this topic from different books, and you know in books lumbar plexus and the sacral plexus are written in separate chapters. So I will try my best to cover both in this lecture, and I will also guide you how much content is needed regarding this topic. First I will cover lumbar plexus and then we will move towards the sacral. As the name indicates, the plexus, so it's a network of nerves, and this nerves network arises from the anterior rami of spinal nerves. So after the anterior rami of upper four lumbar spinal nerves emerges from the intervertebral foramina, they pass into a substance of the psoas major muscle. And here these anterior rami give segmental branches, and these segmental branches supply the psoas muscle and the quadratus lumborum. Segmental branches not only supply these two muscles, but they also break up into anterior and the posterior division within the substance of that muscle, and where they reunite again with each other, and they form a plexus-like arrangement that we name as a lumbar plexus. So hence the lumbar plexus is formed within the substance of the psoas major muscle. Regarding its anatomy, if I ask you a question that tell me the exact anatomical location of a lumbar plexus, your correct answer should be it's located on the posterior abdominal wall. You also have to mention it's located anterior to the transverse process of the lumbar vertebra, and it's located with substance of the psoas major muscle. The area that this plexus supplies is also very important. So remember, this plexus supplies the lower limb. It not only supplies the lower limb but also the lower anterior abdominal wall, and it also gives the sensory branches to a parietal peritoneum. So after covering the anatomical location and the area supplied by the lumbar plexus, now I will tell you about its formation, how it's being formed. So the lumbar plexus is formed by the anterior rami of L1, L2, L3 and L4 spinal nerves. Besides these four lumbar spinal nerves that I have mentioned, it also receives contribution from the T12 nerve, that is mentioned over here is a subcostal nerve. And remember, the fourth lumbar nerve also gives contribution to a lumbosacral trunk, and the lumbosacral trunk will further take part in the formation of a sacral plexus. As we can see in this image, that L1 lumbar nerve is receiving contribution from subcostal nerve, and the fourth lumbar nerve is giving contribution to a lumbosacral trunk. As I had told you, lumbar plexus supplies the lower limb, lower anterior abdominal wall, and it also gives the sensory branches to a parietal peritoneum. Hence, through T12 and L1, it supplies the anterior abdominal wall. Through L2, L3 and L4, it supplies the lower limb, and it also gives branches to a muscle of the posterior abdominal wall, which are the psoas and the quadratus lumborum, and we have seen it was giving segmental branches to these muscles. Obturator nerve, that is a branch of lumbar plexus, it mainly supplies the parietal peritoneum that I mentioned. This is the area supplied by the lumbar plexus as well. Now we will cover the detail of branches of this plexus. There are the three larger branches of this plexus, and besides this there are some smaller branches. So first we will cover three larger branches of this plexus, which are the femoral nerve, which is shown as yellow here. It means it is formed by the posterior division of the L2, L3 and the L4 spinal nerve. Obturator nerve is shown over here as in green. It means it is formed by the anterior division of L2, L3 and the L4 spinal nerve. So remember, both the obturator and the femoral, they are formed by the L2, L3 and the L4 spinal nerve. But what's the difference between them? Difference is femoral is formed by the posterior division and the obturator is formed by the anterior division. Third largest nerve of this plexus is a lumbosacral trunk, and this trunk is formed by the L4 and the L5 lumbar nerve. It is shown as in gray, and I already told you that this lumbosacral trunk is going to take part in the formation of the sacral plexus, as it will join the sacral plexus that we will see later on. So now we will have a look into other smaller nerves of the lumbar plexus, which are shown over here. These are the subcostal nerve from T12, as we can see, ilioinguinal, iliohypogastric nerve from the L1 root value, genitofemoral nerve from L1 and the L2, lateral cutaneous nerve of a thigh, or we can also name this nerve as a lateral femoral cutaneous nerve from L2 and L3, and accessory obturator nerve from L3 and L4. In dissection, we can easily identify these nerve, but how, I will tell you, don't worry. So for this, try to understand this image that I'm going to show you over here and identify the important muscles over here. And we can see the vertebral column. We can also see the 12th rib in this image. In this section, the posterior abdominal wall is shown. And when we remove the muscles of the anterior abdominal wall, the viscera, the kidneys, we can identify the posterior abdominal wall, and that is shown over here in this image. So lateral to vertebral column, there is a muscle which is the psoas major muscle, and lateral to this muscle we can identify another muscle which is a quadratus lumborum. So we can also identify the transversus abdominis that is lateral to the quadratus lumborum muscle. But remember, here in the lumbar plexus, these two muscles, which are the psoas and the quadratus, they are very important muscle. Now we will focus on them. We will look for the relation of the different nerve of the lumbar plexus with that of these two muscles. So by identifying these two muscles on a dissection, you can easily identify the nerves of the lumbar plexus. Now, so we can see the different nerves which are emerging from this area. So how we will identify them while you are doing dissection or when you are going to see these images, it's very easy. Just focus on the nerves that I am going to mention right now. So focus on a femoral nerve. We can see this nerve is on a lateral side of psoas major muscle. When we look into obturator nerve and the lumbosacral trunk, they are on a medial side of the psoas major muscle. We can also see a genitofemoral nerve, and this nerve is anterior to the psoas major muscle. In nutshell, lateral to psoas is femoral, medial to psoas is obturator, and on the surface of psoas is genitofemoral nerve. So hope this will be easy for you when you are doing dissection or when you are going to see these images. So regarding the iliohypogastric and ilioinguinal nerve, remember these nerves are present in a gap in the upper surface between the quadratus lumborum and psoas muscle. So these are the nerve that will pierce the transversus abdominis will be the iliohypogastric. A nerve that is coming down towards the inguinal ligament, that nerve will be ilioinguinal nerve. We can also see another small nerves of the lumbar plexus which are emerging between the quadratus lumborum and the psoas muscle, and that is a lateral femoral cutaneous nerve. But we can see this is emerging from the lower half, while the iliohypogastric and the ilioinguinal that I have told you that were also emerging between the psoas and the quadratus, but they were emerging from its upper half. So after covering the relation of these nerves, we are going to look towards the genitofemoral nerve that is on the surface of a psoas muscle, and we can see it divides into two branches. The lateral branch is femoral nerve and the medial branch of genitofemoral is genital branch. So this nerve takes parts in a reflex, and that reflex is cremasteric reflex. In this reflex, what we are going to do that when we strike on the skin on the upper medial side of a thigh, there is an upward movement of the testis towards, and this is due to a contraction of the cremasteric muscle. So the afferent limb of this reflex is through the femoral branch of the genitofemoral nerve, and also the ilioinguinal nerve is also taking part in the afferent limb, while the efferent limb of this reflex arc is through the genital branch of genitofemoral nerve. Now I will help you to understand this complex table of your book, and I will guide you how much content is important to remember in the lumbar plexus regarding the nerves. As I told you, the segmental branches of this plexus supplies two muscles, which are psoas and the quadratus lumborum, and that we can also see in this table. We have covered the iliohypogastric ilioinguinal nerve that were coming from the L1, I already told you, and these were supplying the anterior abdominal walls. So we can see here the muscles are mentioned over here: external oblique, internal oblique, transversus abdominis. So remember, these are the muscle of anterior abdominal wall. So besides giving motor innervation to these muscles of the anterior abdominal wall, this iliohypogastric and the ilioinguinal nerve, they also give a sensory innervation to skin, and which area these are going to innervate, or on which area the sensory innervation these nerves are going to provide. It's over the lower anterior abdominal wall and the skin of the upper medial side of thigh and the genital area as well. Regarding the lateral cutaneous nerve of thigh, as the name indicate, cutaneous mean it's just giving the sensory innervation, and this nerve is providing sensory innervation to the skin of thigh on the anterior and the lateral surface. As I told you about the genitofemoral nerve, that this nerve is arising from the anterior MI of the L1 and the L2 spinal nerve, and this nerve is involved in the reflex, that is cremasteric reflex. Hence, its femoral branch is sensory, and this nerve is sensory for the anterior surface of the thigh, and its genital branch is motor, and this branch is motor for the cremasteric muscle. We have also seen in the cremasteric reflex as well. So the femoral nerve, that is the largest nerve of this plexus. This is the largest nerve of lumbar plexus, as I already told you, and it is formed by the posterior division of anterior MI of L2, L3 and L4. So remember, this is a mixed nerve, mean it is providing the motor as well as the sensory innervation to the thigh and the leg through several branches. So it supplies the motor supply to a flexor of hip, which are iliacus, pectineus and the sartorius. It also gives a motor supply to extensor of the knee, which are quadriceps femoris, and you know the quadriceps include rectus femoris, vastus lateralis, vastus medialis and the vastus intermedius. Besides this, it also supplies the sensory area, so skin of the anteromedial thigh, skin of the medial leg and the foot, and we can also see sensory supply to the medial leg and the foot. This is why the saphenous nerve. Hence, we can say the saphenous nerve is a sensory nerve that is going to arise from the femoral nerve. Moving towards the last nerve of this plexus, that is the obturator nerve. We have seen that this nerve is formed from the anterior division of anterior MI of spinal nerve L2, L3 and L4. So this is also a mixed nerve like the femoral was. It's also having motor and the sensory branches. So obturator nerve provides a motor supply to muscle mentioned here: gracilis, pectineus, adductor longus, adductor brevis, adductor magnus. And remember, these are the muscle of the medial compartment of thigh. These are the adductor group of thigh. So it also provides the sensory innervation to skin, and the skin of medial surface of a thigh is provided by means of obturator nerve. Besides all this, both the major nerves of this plexus, that are the femoral and the obturator nerve, they are also giving the articular branches to two joints, which are the hip joint and the knee joint. Dear friends, that was all about lumbar plexus. Now I will tell you about the lumbosacral trunk and the sacral plexus. So I told you already that the part of L4 and the L5, it is going to form the lumbosacral trunk. But how? As the part of L4 and the L5 passes down, they are forming a trunk, and this is providing a distribution to a lower limb. So this lumbosacral trunk then joins the sacral plexus. Like I told you about the exact location of the lumbar plexus, so it's also important to remember the exact location of this lumbosacral trunk. So if I ask where this trunk is located or what's its anatomical location, your answer should be at or immediately superior to pelvic brim. Regarding pelvic brim, you can study in a lecture of a pelvis that what the pelvic brim is. So at the level of the pelvic brim, the part of L4, it unites with the anterior ramus of a L5 and they form a thick cord-like trunk. And we name this trunk as a lumbosacral trunk. This lumbosacral trunk, after arising at the level of this brim, it passes through the ala of the sacrum and then it descends into a pelvis. At end, now I will cover about the sacral plexus. So sacral plexus is also a network of nerves like the lumbar plexus was. So this network of nerve is formed by the ventral or the anterior MI of first 4 sacral spinal nerves. After they are going to combine with that of a lumbosacral trunk. So the lumbosacral trunk along with the first 4 sacral spinal nerve, they are going to form sacral plexus. So regarding the exact anatomical location of sacral plexus, it's going to form on the posterior pelvic wall, on the internal surface of the piriformis muscle. And what the piriformis muscle is, you know, this is a muscle of the gluteal region. So the sacral plexus give off the numerous branches including the anterior, posterior branches and the one terminal branch. So these branches provide the motor and the sensory innervation to posterior thigh area, to lower leg, entire foot, and the part of pelvis. Again, I am going to repeat this: posterior thigh area, most of the lower leg, entire foot, and the part of pelvis is being supplied by means of sacral plexus. Remember, the largest and the terminal branch of this plexus is sciatic nerve, and this nerve is formed from both the anterior and the posterior division of anterior rami of spinal nerve, which are L4 to S3. So this nerve consists of two divisions, the tibial nerve and the common peroneal nerve. Difference between the tibial and the common peroneal is tibial is formed from L2, L5, S1 and S3, and this is formed by the union of all 5 anterior division, while the common peroneal is formed by the union of posterior division of L4, L5, S1 and S2. So sciatic nerve provides a motor innervation to the posterior compartment of thigh. Besides providing the motor innervation, the sciatic nerve is also giving the sensory innervation to the lateral side of leg, foot, and also to lower third of anterior surface of the leg and foot. Now I will tell you about the other smaller branches of this sacral plexus, which are arising from the anterior and the posterior division of these spinal nerves. So first we will cover the smaller branches which are arising from the posterior division of sacral plexus, and then I will cover the smaller branches which are arising from the anterior division of sacral plexus. So from posterior division, the branches that arises are superior gluteal nerve, inferior gluteal nerve, nerve to piriformis, and the perforating cutaneous nerve. From anterior division of sacral plexus, the nerve that arises are nerve to quadratus femoris, nerve to obturator internus, nerve to superior and the inferior gemelli, pudendal nerve, and the nerve to levator ani and the coccygeus. Again, focus on this complex table to understand the nerves of the sacral plexus. So we can see above 5 nerves which are mentioned over here. These are going to supply the muscles of gluteal region. So muscles of gluteal region are supplied by means of sacral plexus. We can also see perforating cutaneous nerve, as the name indicates, cutaneous. So this is a sensory nerve to medial side of buttock area. So the posterior cutaneous nerve of thigh, again as the name indicates, cutaneous. This is also a sensory nerve that is supplying the posterior surface of thigh, lower side of buttock, scrotum and the labial area. So pudendal nerve is a nerve of perineum, and this nerve is going to supply muscles of skin and perineum. Lastly, the sciatic nerve, that is the thickest nerve of body. This nerve is having two components, as I already told you, the tibial and the common peroneal. Here the complex muscle I mentioned over here that you will cover when you will study the posterior thigh and the leg compartment. So it's not necessary to remember the name of each muscle, but at least the area supplied by the motor muscle supplied by this nerve, you should remember this. So important to remember is this nerve not only supplies these muscles which are mentioned over here, but it also supplies the skin. So its tibial part supplies the skin on the lateral side of leg and foot via the sural branch, and its common peroneal part supplies the skin over lower part of anterior surface of leg and dorsum of foot. Dear friends, that was all about detail of lumbar and the sacral plexus that you should know at least regarding your exam point of view.